Poso maoni wiak, waiwanan kitana ni mua e yoski piataya posnotaman e yum MITW Podcast. A yospis piataya posnapi notaman e ne hisikimaka e yoso matnamin e hakihi.
Welcome to the Menominee Indian Tribe of Wisconsin podcast. We are your hosts, Gary Dodge and
Sheena Mapus. On this episode, we are joined by Vaughn Bowles, Public Information Officer for the Menominee Indian Tribe of Wisconsin. And we would like to remind people that we request you send in your COVID-19 related questions to us at podcast@mitw.org. Welcome, Vaughn.
Hi, guys.
For another wonderful week.
Oh, yes, it is. Happy Friday.
Okay, so this past week we've seemed to have seen a large spike in cases. That was a tongue twister. Just locally and also within the Midwest. So can you talk about that?
Yeah, so, disease spread, like anything, takes a little bit of time, and we're kind of at a point where both Atlantic and Pacific coasts have kind of seen the worst of COVID, and it's moved inwards towards the Midwest and the Rocky Mountains. So yeah, we have had an increase of cases. It's not totally unexpected. Wisconsin has probably had the most that it's ever had at this point, along with Wyoming, the Dakotas, and Iowa have all really had a large increase in COVID cases. It's increased in these states between 30 and 35% in some cases. And just to give you a heads up, just this last week, from the 18th, last Friday to today, Wisconsin's diagnosed 16,082 new positive cases. So it's a lot. It's been quite an increase in this last week. It's hard to pin down what specific reasons have caused that. About half of the cases on the reservation have been, community spread. So we can't say you've had direct contact. So it's out there and it's more prevalent now. And so people need to be aware of its presence, and rather than, letting their guard down and, going on rather laissez-faire about the situation. So just be aware, there's more COVID out there now in Wisconsin than there has been in a while. So keep yourself safe.
Has that been the case for Shutdown as well? They've had also a huge spike in cases.
Shutdown has had a very large increase in cases. Langlade also has, Langlade not as much. Sorry, Oconto County has, and Brown County has quite a bit. Mm-hmm. So right around us, with us, it's here, and it's on the rise right now. So yeah, please be aware.
So I see this argument being made a lot about masks, and that somehow wearing masks makes the virus worse or makes you more susceptible to the virus. Okay. Is there any science behind that?
So I'm just going to throw this out there for everyone to think about. So one of the problems with the COVID response being kind of hyper politicized is that on top of like low quality information that may get put out, there's also disinformation that gets put out there, where individuals will actually deny factual science that's based by scientific research. And I'm just totally air quoting right here, I've seen information on both sides of the mask effectiveness issue. And so really what people should be doing is really evaluating the source that they're getting information from. Ask yourself whether it's reasonable. I find good sources to be the Center of Disease Control, or the CDC, World Health Organization, or the WHO, the Department of Health Services, or DHS, and Johns Hopkins University, all very good, and have been pretty consistent about their messaging, to this point. Part of the reason that they say don't wear masks for specific individuals isn't necessarily that it increases the viral load, but it can decrease the amount of oxygen that you're taking in at one time, because as you breathe out, you're obviously exhaling CO2, and so it creates a CO2-rich environment right around the mask where people are breathing. So that's why they have people with like respiratory issues and young children kind of avoid masks. I have seen evidence that the prolonged mask usage actually increases bacterial infection, not necessarily COVID related, but those can cause things like pneumonia and other respiratory issues. So you really want to make sure you're not reusing the same mask too long if it's a disposable mask, because it can grow all sorts of wonderful little things in it. Or if you have a reusable mask with filters, change your filter out regularly or wash your mask where appropriate. So there are cases where people do get sick, and then it becomes a question of how are they utilizing their mask. As far as viral spread, it seems pretty consistent, though, that it does seem to reduce the amount of virus that a person might exhale. So evaluate your sources, evaluate your mask usage, and just kind of be cognizant of how you're approaching the whole mask debate, I would say.
So with the rise of local cases, will the tribe be extending closure and like schools and stuff? Can you kind of go over that?
Yeah, so our emergency management coordinator met with the Menominee Tribal Legislature. They did look at the number of increased cases here on the reservation, kind of per recommendation of Dr. Schlegel and the incident command team. We decided that we're going to extend the closure for 7 more days. That will be till October 5th. So until that time, the mask requirements are in place. Telework will be in place. The curfew will be in place. So please don't be out after 10 unless, it's a work-related issue or, emergency health is needed. And so just be cognizant of that. It'll be 1 more week. We're going to reevaluate. Hopefully our caseload will go down and we'll be able to reopen everything back to a fairly regular state. So.
Okay, and then kind of along with the rising cases, do we know what age range is testing positive the most?
So testing positive the most, locally I can't say due to HIPAA reasons. We have ages from a 3-year-old who contracted a positive case up to, octogenarians. That can be our great vocabulary word for the day, 80-year-olds. Statewide, the group that tests positive most frequently is actually age 20 to 29. That makes up more than a quarter of the positive cases here in Wisconsin. It's 26%, not a lot more, just a little bit more. And then other age groups, 10 to 19, 30 to 39, 40 to 49, and 50 to 59. They're all pretty equal, with about 15% of the rest of the cases. So it's pretty evenly distributed and stuff, besides that one group. And then something to consider, though, even though it's fairly evenly distributed among the ages, it disproportionately affects our senior citizens for severity of cases. More than a quarter of those cases for ages 70 and older end up in hospitals needing ICU and intensive care. And so even though I guess I could say you, Gary, as a young individual or young listeners, might not be affected as much. If you contract it, be aware that you could greatly affect the health of someone who's older than you.
Is there anything else you'd like to add?
Just like to thank Myrna Warrington, member of the Menominee Tribal Legislature, for sitting down with us this week and creating a video about Menominee resilience and stuff during this time of COVID and how it affects our community. Really wanted to thank her for that. You can find that on YouTube, Gina? Yes?
Yeah.
No?
Yes.
Awesome.
The channel name is MITW Multimedia.
Awesome. Check it out. It's a nice little 8-minute video. And I really appreciated her sitting down with us and recording that. So, yeah. Stay safe this weekend, everyone. Stay healthy.
Waiwanan for listening to the Menominee Indian Tribe of Wisconsin podcast. You can find us on Apple Podcasts, Spotify, and Stitcher. You can also listen to the podcast on menominee-nsn.gov under the Community tab. Keep up to date by following us on Facebook at MITW Podcast. We do weekly updates with Vaughn and welcome any community questions you have regarding COVID-19. Please send them in to us via email at podcast@mitw.org.